That's a lot of stuff to unpack in that question. So I'm going to try to have some general assistance with that. So symptoms of mental health challenges can change over time, as the question alluded to, depending on what stage the child is in. And so, this may include difficulties in how they play, or how they learn, or how they act, or how they handle their emotions, particularly if they're younger. So symptoms of mental health struggles often happen in early childhood, and some of these develop even further into the teenage years. So they often start when the child is younger. And the diagnosis for these can often be made in the school year, although a lot of times children go undiagnosed for a very long time and are kind of labeled as being problem children, which is an issue. So some examples of these mental health disorders include anxiety, depression, ADHD, post-traumatic stress, just to name a few. It's important to recognize that mental health disorders can affect any child of any gender, of any age, and it's estimated that anywhere up to 20% of kids pre-pandemic had mental health disorders, and that has only kind of escalated since COVID started. So general things that we can think about in terms of stressors for kids, or ways that we can identify stressors, are some physical attributes. Have they exhibited a decreased appetite? Are they constantly complaining of headaches or stomach aches? Is there new bedwetting? Are they having nightmares? And having lots of physical symptoms even when they're not actually ill. There's also emotional and behavioral symptoms that we can look out for, and this is kind of regardless of age. Just the inability to relax, having kind of fears that are out of proportion to what they're going to face, not being able to let you out of their sight, kind of being clingy for younger children, having aggressive behavior, not being able to control their emotions. And then for younger kids, regressing in terms of their behaviors, doing things they used to do when they were toddlers, even though they're older children. So those are all kind of signs and symptoms that something might be going on. And I think for teenagers in particular, given the mental health distress that teenagers had in this COVID year, really, really paying attention to your teenagers' behavior. Are they withdrawn? Are they quiet? Are they interacting socially with friends? Those are all very, very important signs.